My name's Karin Carroll. I'm the Public Health Director here in the City of Gloucester, and I'm here today with Kelley Ries, our Public Health Nurse, and we're going to talk to you about some summer health issues that we're thinking a lot about this spring and as we head into a hot summer already. And it's part of a new program that we're trying in the Health Department where each season we're going to come and talk to you and provide information and on a range of topics for that season. So for today, we're going to talk predominantly about things to do with summer health and safety. So Kelley Ries will start us off talking a little bit about sun safety and some of the exciting initiatives going on around the city as well.
Yeah, so this year the Health Department has partnered with Impact Melanoma, which is formerly known as Melanoma Foundation of New England, and we partnered with them to get some sunscreen dispensers to install at our beaches and our visitor center. So these sunscreen dispensers are very similar to a hand sanitizer dispenser. It dispenses 30 SPF. And you would apply that every couple of hours. If you're playing or swimming, always want to reapply the sunscreen every 2 hours. And so the Melanoma Foundation, or Impact Melanoma, will also be coming out to do a screening day. And this includes a facial scanner that you can go and get your face scanned to help people understand the damaging effects of the sun. So this is a free event, and they'll also come with some educational resources and other goodies that we can provide during that day. Skin cancer is the most common cancer in the United States, and current estimates that 1 in 5 Americans will develop skin cancer in their lifetime. So this is a great opportunity for us to partner with Impact Melanoma this summer to provide this awareness and education. We have a lot of flyers in our health department that speak to checking your skin, and when detected early, skin cancer is highly treatable. So we always encourage the A, B, C, D, E of checking your moles or freckles on your skin. And so the A is asymmetry. B is border, so if it's irregularly shaped and it doesn't really have a defined border. C is color. So this is when it's kind of a black, dark color. D is diameter. I think they say when melanomas are usually greater than 6 millimeters, that is when to have some concern and to seek your doctor's expertise. And then E is for evolving. So if your mole or freckle that you've noticed has changed over time, that is when you also want to go see your physician or a board-certified dermatologist. So we really encourage you to check your spots. If you have someone else in your household, a spouse or a child, to look at your back. You can use a mirror to check your back, because that is most commonly found places, especially on men, is where skin cancer is found. And what else? So early detection saves lives. So it is very important that we're using sunscreen appropriately. We're wearing hats at the beach. We are in the shade if you have umbrellas from 10 to 2 as the peak sun times. So always want to protect our skin during those times. And I know, Karin, you're going to speak to some other heat-related illnesses too that we want to be cautious of this summer.
Great. Thanks, Kelley.
Sure.
And that will be an exciting event at the beaches to look forward to. And we'll hear more about that on our Facebook page as it gets closer in the newspaper. So another big concern of ours in public health, in the community, public safety, is extreme heat. And when our cities or urban areas especially, or anywhere it gets really hot outside and the humidity's high, we see a lot of hospital admissions, a lot of calls to 911, a lot of people getting sick or injured from extreme heat. So this is totally preventable, and we want to make sure we get the word out and people understand what they can do to protect themselves and watch for the early signs of heat exhaustion or for extreme heat. So here, this is a nice little brochure that's in our display cabinet, and it talks about, it's a CDC, it talks about some of the key factors: stay cool, So like Kelley said, you want to stay out of the sun between 10 and 2. If you have outdoor activities that you're going to engage in, sports or gardening, try to arrange those to do them in the early part of the day or after 2 in the late afternoon when things cool down. Stay hydrated, especially if you are working outside or working out outside, going to the beach, any of those activities. Make sure that you're drinking 2 to 4 glasses of liquid an hour. And stay informed. Keep an eye on the weather, keep an eye on the heat index and what's going on in your local community. In the event of extreme heat, the City of Gloucester will post on its Facebook pages where you can go to get cool. And there's often a few different cooling stations available throughout the city for folks. Elderly are at particular risk, and it's important to check on elders if you can, and make sure that they're doing okay and they're drinking even when they don't feel thirsty. Same thing with a fan. A fan may give the feeling that you're cooling down, but fans can actually further dehydrate, and an elderly person may not sense the heat and that they are actually overheating. So keep an eye on those groups in particular. Children and pets, of course, never leave in a car. Cars can overheat and get very, very hot. So never leave those small children or pets unattended, and keep an eye on them as well, that they're getting the necessary fluids they need and keeping cool. If you have an air conditioner, that's going to be the best bet on a really hot day. Cool that body temperature down. And a couple other signs of heat exhaustion. I know this can happen quickly for someone who might be out gardening midday, heavy sweating, some weakness, cold, pale, or clammy skin, a fast or weak pulse, nausea, vomiting, fainting. So if you feel any of those signs or see anyone with those signs, encourage them to come in, cool down, drink some water. And you need to seek immediate medical care if you have someone with any of the following symptoms: a high body temperature above 103 degrees Fahrenheit, hot, red, dry, or moist skin, a rapid or strong pulse, and possible unconsciousness. So those are signs of heat stroke that you need to really take seriously and get help right away. So again, heat stroke is a really preventable issue in our community, and it does affect a large number of us. So be safe, have fun in the sun, enjoy the warm weather, but keep an eye out for heat exhaustion and the toll it can take on your body. So we'll leave that topic, and a couple more things that we want to talk to you about that are particularly relevant this time of year. And if you haven't guessed, it's ticks and mosquitoes. Mm-hmm. So Kelley has done a lot of great work on that, and she'll talk to you a little bit more about what you can do to protect yourself.
So this season, I bet a lot of you have noticed an increase in the ticks and mosquitoes that are out at this time. And so our role at the health department is to promote prevention and personal protection. And then we also do surveillance and investigation at the health department. So we're all on top of it, but it is up to you as well to help protect yourself from tick and mosquito bites. So some of the tools that you could use is if you are outside, and if you're in a walking along a path, if you're hiking, to stay on that path. Don't divert from that where there's tall grass and leaves. That's where a lot of the ticks like to live, and they can crawl up to you and you take them home. So we want to avoid that. You can also wear an insect repellent that contains DEET for your skin, and then also permethrin, which can go on clothing and shoes. And if you don't want to use any EPA-approved chemicals, you can also use some alternatives, such as lemon with eucalyptus oil. But again, those are not EPA approved. And if you have questions about any insect repellents, the cdc.gov is a good website to kind of see a wide range of repellents that you can use. The other most important thing about preventing tick bites is to do a tick check daily. So after your daily outdoor activities with your kids, you're playing in the yard, kind of line up your kids and yourself and do a tick check. So ticks like to hide in warm, moist places and dark places. So it could be along the hairline, behind the ears, under armpits, behind your knees, in your groin, really anywhere. And at this time, the stage of the ticks are about a nymph. so it looks like a little freckle. So it can be very difficult to spot, so just look very carefully. And also, if you've been out, another trick to use is to use a lint roller on your clothes and your pet before you come inside. So that will remove any unattached ticks. Take your clothes off, put them in the dryer for 15 minutes, and that will also kill any unattached ticks on your clothes. And then hop right into the shower. And then you can do your tick check any time in between that. But those are some good tips to help see if you have any ticks on you and to remove them. The best way and most effective way to remove a tick, we don't want to get into all those myths of using nail polish remover and different things like that. So the most effective way is to use a tweezer to remove the tick that may be attached to you. So just get really close to the head and pull straight out. And also at the health department, we have these tick removal spoons. So you can come, they're free. I also hand them out at a variety of locations. If I'm at the farmer's market or health fairs, I'll have them there for you. But these are also another way to remove the tick. You get right close to the head, scoop it out, the tick's right there. You can flush it down the toilet or do whatever you want to it. So those are available as well. You'll also want to note on your calendar the date and time that you removed the tick. This will be helpful if you start to notice any signs and symptoms of a tick-related illness, which can include some fatigue, flu-like symptoms, weakness, joint aches and pains. So if you start to notice those things, it could be up to even a month after you removed the tick, then go seek your doctor for some medical advice. Let's see, so and then other ways to help prevent mosquito bites is mosquitoes that carry diseases are most often found at dusk and dawn. So try to avoid those times or use insect repellent during those times. You want to remove any standing water around your home, so bird baths, you want to empty those at least weekly. If you have any tires that are filling up with water, or the little wading pools that you might have for your kids or dogs to cool off in, just make sure every few days you're emptying that because the mosquitoes do lay their eggs in those little pools of water. So by removing it, you just eliminated an all new batch of mosquitoes. Also, it's good to check your home to see if there's any screens that might be loose or have holes in them, and to repair those, and also around your doorways if there's any little ways that mosquitoes can get in. That's time to do that too. And I think that is it. So like I said, we have a lot of materials that, here's a tick bookmark that you can use. We have tick identification cards that talk about the different types of tick found in our area, as well as the sizes. So these are actual true to size, so you can see how small the nymph is. It's really a pinpoint. So really keeping a close eye on checking yourself daily for that. We also have other pamphlets here as well to remind you to do some prevention measures. So I have these. I go out to a lot of locations. I deliver these. These will be available at the health department, at City Hall, Senior Center, the library, and then I'll also be out at farmers markets this summer helping promote tick and mosquito-borne illnesses. So yep. I hope you found all that helpful. Yeah, the most reliable websites to get any more information is mass.gov or cdc.gov. The health department does do updates with any issues that the state or our local Essex County might have any precautions. We also notify the public that way as well.
Mm-hmm. And speaking of that, Kelley, I wonder if you want to show them on this flyer that sure. you designed, the scanning there.
Yeah, so this flyer will be available at those locations I listed as well. And we actually have started using this QR code. So if you download on your smartphone an app that will scan this code, and it will go directly to the mass.gov website that shows you different methods to how to keep your outdoor space safe and personal protection, things like that. So it's a great tool to use on our flyers.
That's great. Thank you, Kelley. And yes, like Kelley mentioned, these display boards are up. There's one up in the CADA building on 3 Pond Road at the Health Department that you can come and have a look and take copies of flyers or tick spoons as you need them. And we'll also have a newsletter with a lot of different summer health issues that we'll put on our Facebook page that people can have a look at, because of course there are other things we want you to be careful of in the summertime, food safety, and there's a range of things to think about. But most important, we want you to get out there and enjoy the summer and the beautiful nature around us in this part of New England, and have some fun with it.
Right.
So in closing, we'll come back in the fall with another segment on autumn health issues, back to school stuff, and some other issues that come up around that time of year. But we wanted to let you know about a couple initiatives that have come out of the health department as well recently. There's a citywide workplace wellness and safety committee that's formed. That committee is taking on a number of projects, reviewing some health policies for the city, and encouraging some activity, employees getting out there and becoming more physically active, maybe during the workday, taking breaks to walk or standing up occasionally. They've also recently held a CPR training for all city employees, and we've had great attendance, and we've been able to train well over 100 city employees already to date. Kelley's organized to have AED machines, defibrillators put into all the city buildings, so that as a community that makes us all a little bit safer if these things are available, should there be a problem. And also in the training we were able to cover how to administer Narcan in the event of an overdose. And we've also been able to put a tube of Narcan or a container in each of our AED cabinets. So again, in all city buildings, there will be a Narcan bottle available if needed. And then again, that's a great thing for our community, keep us all safe. And we appreciate Kelley's hard work on that and the other departments within the city that we've partnered with. So I think that's all for today, and happy, healthy summer.